Hi.
Hi.
Welcome back. We're going to do your physical exam.
Okay.
And we checked your weight and your height, and you are,
Yeah, sorry.
that's okay. Your height is 5'8",
8.
and you are 200 pounds, correct?
Correct.
Okay, and we also checked your oxygen saturation, and it was 100%, and your heart rate was 80. I will check your pulse to see if it's regular, and we're going to check your blood pressure. And your blood pressure is 122/80. Just gonna check your pulse. And your pulse is nice and regular. We did check your temp in the other room, and it was 98.2. The first thing I'm going to do is I'm going to look at your head and your hair. And looking at your hair, it's evenly distributed. There's no infestation. Feels good. Any dryness?
No.
Okay. And your face is symmetrical. And we're also going to take a look at your skin. So I'm taking a look at your skin. I'm going to take note. Are you coming forward?
Mhm.
I'm sorry. Look to see if there are any concerning moles. Have you ever been to a dermatologist?
No.
And I'm just going to take a look at your fingertips. And there's no cyanosis noted, no clubbing, good cap refill, less than 2 seconds. And the next thing that we're going to do is we looked at your face, and I'm going to just check your TMJ. So I'm going to put my hand at the upper part of your jaw, and we have you open it, and we're looking for clicks or pain or tenderness. So this is your TMJ. I'm just going to have you open your mouth and close. Do you have any pain or tenderness when you do that?
No.
And I don't feel any clicks. I also am going to check your lymph nodes, and I'll do your neck ones and your chest ones as well, just to be complete. So to check your lymph nodes, we have our pre-auricular and our post-auricular, our occipital, our tonsillar, our submandibular, our submental, pre-cervical, and post-cervical, and excuse me, I'm sorry, and we're just going to feel above at your supraclavicular. And I don't feel anything. Do you have any tenderness?
No.
Okay, and it's normal not to actually feel anything because we don't want any swelling there, but if we did, we would follow up.
Okay.
I'm going to inspect your mouth, and I'll just, you have a symmetrical mouth. I'll have you open up your mouth. Stick out your tongue for me. And so your uvula is centrally located. I don't see, I'm going to move your tongue a little bit. No cavities, no lesions. Do you have any tenderness in your gums or bleeding of your gums?
No.
The next thing I'm going to look at is your eyes. I'm going to take a look, and we're looking for pupil constriction, and I'm look at pupil size. I'm also going to take a look at your conjunctiva, which is nice and pink, and your sclera is clear. I'm just going to take a look at the light. And your pupil size is 3 and reactive. Very good. And we're going to do the 6 cardinal eye movements. So if you could just follow my fingers. And that's good. We also did a Snell chart test, and with while covering one eye, and we held it 14 inches away because it was a handheld Snell test, And with your corrective lenses, your vision is 20/20. And you said you recently followed up with your ophthalmologist.
Yeah.
And so the next thing that we're going to look at is your ears. And the first thing we're going to do is I'm going to feel your tragus and make sure that there's no pressure there. So I'm going to just feel here. Any pressure?
No.
Okay. And I see your piercings. Have you ever had any redness or infections with your piercings? Okay.
No.
And everything feels normal. It looks symmetrical. No pain when we pull up or down.
No.
Okay. And I'm going to just take a look in your ear. I'm going to just pull up and take a look. And I'm just taking a look at your eardrum. And it's in mid position. And it's a nice gray color. And there's no bulging noted. I'm just going to do the same on the other side. And the same here, it's in a neutral position, no bulgings noted, and it's a nice shiny gray.
Okay.
The next thing that we also notice that everything is symmetrical with your ears. I'm going to inspect your nose. No nasal drainage or anything like that. I'm just going to take a quick peek, up your nose and just make sure that there's nothing that we see there. No drainage. No lesions. We are also going to check your neck. So are you able to move your neck?
Yep.
Do you have good range of motion, side to side? Can do a good circle.
Yep.
No pain or tenderness when we look at your neck? Okay.
No.
And then we also want to look at the vessels of the neck and your carotid. So I'm going to just take a look with my light. And everything looks good. And I'll have you lie down in 2 secs.
Okay.
Sorry. No, and I'll have you lie down. And we're just noting to look for no JVD, and I don't see any on this side. And then look on the other side, and I don't see any JVD. And I'll palpate both carotids. And to your other side. Okay, and you can sit up, so.
Okay.
And I also want to check your trachea and your thyroid. And for your trachea, I'm just going to have you swallow. And you can see it's midline. And for your thyroid, I'm just going to go behind you. I'm sorry.
Okay.
And we're just going to feel from the back for enlargement. We're going to displace it. And it's in the right position. Do you have any tenderness there?
No.
Have you noticed any problems with palpitations
No.
or sweating?
No.
Okay. Next, we're going to look at your chest and your lungs and also listen to your heart sounds.
Okay.
So just looking at you, I can see that your chest rise is equal and that it's not asymmetrical. The first thing that we're going to do is palpate your chest. So I'm feeling to make sure that there's no crepitus. And I'm going to feel your back as well. And there's no crepitus. And then I'm going to percuss your chest, and I should feel a resonance. If it was, if we felt dullness, that would mean that there was fluid. And I'll just have you sit forward for me if you don't mind. No, sit at
sorry.
the edge. That's okay. I'm just going to do a check of your CVA, tenderness of your kidneys. Any tenderness?
No.
Okay. And listen to your lungs. Deep breath. Okay. The one thing I forgot to do with our face is I forgot to palpate your sinuses, so I'm going to palpate your sinuses and percuss them.
Okay.
Your frontal sinus we're just going to palpate, and your maxillary sinus, and then we're going to percuss as well. And again, we're looking for fluid. Did you have any pain or tenderness with that?
No.
Okay, and going back to our lungs, your lung sounds were nice and clear. We're going to also take a listen to your heart sounds.
Okay.
And we're going to listen for your S1 and S2 heart sounds. And that's over on, you start on the right with the diaphragm on the second intercostal space for your S1. And listening to your S2. And down at the apex. And I'll have you lay down just to check your PMI. Okay. We're going to check and feel your PMI. And we're going to take a listen. And with the diaphragm, we're also going to listen to the S3 and S4 sounds. Same over the right. And I hear no thrills or murmurs. Okay. And while we're here, we're also going to listen and inspect and look at your abdomen. So I'm going to keep you covered. So we're inspecting and we're going to look to see if there's any deformity or, I'm sorry, I apologize, or any abnormalities. Could you lift your head up and cough? And we're just checking for hernias. And we're going to lightly palpate for pain. Do you have any pain with palpation? Okay, we're going to do some medium palpation. And some deep palpation. And no rebound tenderness?
No.
Okay. We're also going to try to see if we can feel the liver or the liver border. Which I can't, which is good. And I'm also going to listen to your bowel sounds in all 4 quadrants. And you have good bowel sounds. You can sit up if you want. So, moving on to your musculoskeletal, I'm going to palpate and feel your joints.
Okay.
Do you have any joint issues?
No.
Okay. So can you shrug your shoulders up and then push them down? And are you able to lift up your arms? All right, good. And no issues at the joint?
No.
Both sides? And how about your legs? Can you lift them up? Both legs? Push up against? There you go. Now push down. Good. And I'll have you stand up. And can you bend at your trunk?
Yep.
Good. And you have good mobility with your hips?
Yes.
Beautiful. I'll have you sit back down. And I'm just going to palpate your pulses.
Okay.
And your radial. And your brachial. And your radial on this side. And your brachial. Popliteal. One sec for the hip. Your dorsalis pedis. And we'll do the same on the other side. This is your radial and brachial on this side. We're going to do your popliteal. Tibial. And sorry.
Okay.
Your dorsalis pedis. Beautiful. We're also gonna check your reflexes. And again, I'll just have you keep your arms slack. Good. And then you again. Wrist. And the wrist. And your knee. The Achilles. And so I'm also want to test your reflexes, and at the end we'll talk about our self-breast exam.
Okay.
So I just want to ask you if you could tell me where I'm touching.
Okay.
Okay.
My left cheek. Right cheek. Right hand. Left arm. Right arm. Right leg. Left leg.
Very good. And I just want you to you can open your eyes and actually close your eyes again and tell me if it's soft or sharp.
Sharp. Sharp. Dull. Soft. Soft.
Okay. And we're just going to check your strength and your gait. So I'll have you hold up your arms, and can you push up against me? And then push down. Beautiful. And the same thing, lift up with your legs, push up, and then pull down. Beautiful. And we'll check your gait, if you could stand, and just walk in a normal fashion. And come back. And then I would have you walk in a heel to toe.
Okay.
And I'll have you face me, and if you can close your eyes and hold out your hands. And can you flip your arms over? Good. And bring them down. And do you have any dizziness when you do that?
No.
And I'll have you squeeze my hands. Very good. And you can have a seat. And we'll talk about the self-breast exam, because we sort of skipped over that. So you should probably check your yourself every 5 to 7 days after your menstrual cycle. And there are 3 positions that you would check your breasts in. The first is just regular, and you also want to take a look when you're looking in the mirror and just take a look at yourself before you even do that and see if you notice any lumps or dimpling or anything that's different, because you know you the best. And so when we're checking, we're going to have our hands down, and you're going to go in a circular motion around each area of the breast. And then you're also going to do it underneath your arm and on the other side. The other way to check is with your hands on your hip, and then we're going to do the same thing, and then overhead. And it helps to do it either laying down, and then you could do it standing up, because sometimes things feel differently.
Okay.
And they suggest that you should do it once a month. The older you get, the more risk that you have, and if you have any family history of breast cancer, the best way to prevent it is to do daily checks.
Okay.
Do you have anything that you wanted to discuss before I left today?
Nope.
Is there anything that you think that we missed that you feel that we need to check while you're here?
No.
All right, thank you very much. It was
Thank
nice
you.
meeting you, and
Nice
I'll
meeting
see
you
you
too.
at our next visit.
Yes. Thank
All
you.
right, thank you.